At some point in our lives, we are all going to have to come face to face with the process of dying, whether it's from a loved one or our own death. The Death with Dignity Act allows patients relief from the pain and loss of autonomy and the decline of the quality of life that comes along with life-ending illnesses. I've watched 3 of my grandparents suffer through the last few weeks of life. I've also worked in a hospital setting where I've seen patients who are suffering from life-ending illnesses come in and out of the hospital constantly. I've seen their decline of their physical abilities and their mental abilities. So patients with life-ending illnesses go through many different thoughts and feelings when they are diagnosed or near the end of their life. Mentally, the news and the diagnosis can come as a shock. This can cause depression and fear, knowing that their life is about to be over. Emotionally, they know they have to say goodbye to their loved ones. They also know that their loved ones are going to have to say goodbye to them, and they're going to have to deal with seeing the pain and suffering, not only from themselves, but also from the people around them. And physically, the patient's bodies will start to turn against them. There could be pain through the disease that they have or the treatments that come along with the disease, like radiation, chemo, or dialysis, or side effects from medications that they take. They may be in so much pain they have to take morphine, which could cause them to be in a coma for their last few months or weeks or days. They can also lose functions of different body parts. They could no longer be able to use the restroom on their own, or they may become prisoners inside of their own body, not being able to move or speak, and become dependent on people or somebody else 24/7. But the Death with Dignity Act can provide comfort and peace for both the patient and the patient's families. A good example of a patient who was in social media recently was Brittany Menard. She was a 29-year-old woman who was recently married and lived in California. After months of a terrible migraine that wouldn't go away, she was diagnosed with brain cancer in 2014. She was told that her tumor was so large she was going to have full brain radiation. After research, she had decided that the side effects from radiation would just decline her quality of life even faster than if she had decided not to do any treatments. This is whenever she researched the Death with Dignity Act and decided to move to Oregon, where it was legal at the time. So her and her family moved to Oregon. After applying for residency, changing all of their physicians, she was finally able to get the prescription for the lethal medication that they give you through the Death with Dignity Act. In an interview with CNN, she stated that once she had her prescription filled and it's in her possession, she experienced a tremendous sense of relief instantly, and she knew if she decided to change her mind about taking the medication, she didn't have to take it. Once she had that medication, she was able to focus on living the last few months of her life a lot better. She was able to focus on her bucket list, going to the Grand Canyon with her husband, and she traveled overseas with her parents. So she was able to, instead of focus on the pain that was coming and the suffering that was coming, she was able to live a happier life. And after she got everything on her bucket list done, and she knew that her headache was getting worse and she knew she was about to be in a lot of pain, she was able to die peacefully in her sleep, surrounded by all of her loved ones. Another example of this, Charlie and Francie Emmerich. They were a couple that decided to do the Death with Dignity Act together because they were both near the end of their life. Their daughter, Cher Safran, and her husband, Rob, actually created a documentary of their parents' last weeks alive before they decided to take their own lives. In this documentary, it showed how much easier the dying process was when the couple had control of their own death. They were able to get all of their family together one last time for a wedding anniversary / memorial service for themselves. They were able to say goodbye to everybody. They were able to celebrate with everybody. And instead of tears, there was laughter and happiness. And a couple weeks later, the couple were able to die peacefully in their sleep together, holding hands in their bed. And neither one of them had to suffer from the pain and the lack of autonomy that was inevitable. So in conclusion, I feel like all humans that have the right to live should also have the right to a death with dignity. Just like everything else in the world, legalization of the physician-assisted death will be a long and bumpy road. There will also be some who try to abuse it, and there will be a lot of hurdles to overcome. These should all be risks we're all willing to take to better not only our end-of-life care, but the end-of-life care for everyone around us. Because one day, we are all going to be there.